Asthma. Asthma is a condition that causes difficulty with the mechanics of breathing, making it hard for your child to breathe. Episodes or exacerbations are called an asthma attack. Asthma attacks occur most often in the early morning or at night and may be precipitated by seasonal allergies, cold temperatures, and exercise. Things that activate or set off an asthma attack are called triggers. Asthma triggers vary with each child. Basically, asthma is an inflammatory condition of the airways. More specifically, it is the combination of the constriction or narrowing of an airway and increased mucus production that causes breathing difficulty. Constriction and overproduction of mucus happens throughout the airway in the trachea, bronchi, and bronchioles. With asthma, it is the bronchioles where the air highway divides and gets smaller that is most affected by constriction and mucus production. What causes asthma? Asthma is thought of as a hyperreaction of the airways. What this means is that people with asthma are more sensitive to a host of common triggers which irritate the airways, especially the bronchioles. The irritated bronchioles constrict or get narrow, as well as have increased mucus production. In most people, asthma is the result of being born with a hypersensitive immune system. The hypersensitivity of the immune system causes the airways to constrict and get clogged with mucus, thus making it difficult to breathe. Asthma is not a problem of the anatomy of airway and lungs. It is more about the response, the hyperreaction, where constriction and overproduction of mucus occur in the airway. The smooth muscle that lines the airway starts out normal. Recurrent asthma attacks lead to long-term negative structural changes causing scarring. As the smooth muscle lining the airway scars, the condition gets worse. Scarred and damaged airways become more easily triggered and more often with a higher intensity response. This leads to more frequent and intense asthma attacks. An exact cause of asthma has not yet been identified. What we do know is asthma runs in families. Asthma is more common in people who have allergies, although not everyone who has asthma has allergies, and not everyone who has allergies gets asthma. Pollution and other environmental factors can exacerbate asthma. What are the symptoms of asthma? Asthma presents with wheezing, coughing, and difficulty breathing. Signs and symptoms we may see with our children are as follows. Frequent coughing spells, which may occur during play, at night, or while laughing or crying. A chronic cough, which may be the only symptom. Less energy during play. Rapid breathing intermittently. Complaint of chest tightness or chest hurting. Whistling sound when breathing in or out, called wheezing. Seesaw motion in the chest from labored breathing. These motions are also called retractions. Shortness of breath or loss of breath. Tightened neck and chest muscles, feeling of weakness or tiredness, being moody. This hyperreaction of the airways with narrowing of the pathways and increased mucus is generally triggered by a specific thing called asthma triggers. Common asthma triggers include respiratory infections like colds, bronchitis, pneumonia, and croup. Respiratory infections are the most common triggers with pediatric asthma. Respiratory infections affects anyone's breathing with the already more fragile respiratory system of a child with asthma. Asthma attacks occur more frequently and more intensely when a respiratory infection is present. Inhaled substances like cigarette smoke, air pollution, cleaning products, lawn products, or other chemical substances. Other inhaled substances include the gamut of bioallergens. Bioallergens may be seasonal like grass pollens, ragweed, tree pollens, and fungal spores, or perennial like dust mites, cockroaches, pets, and mold. When we breathe in the smoke, pollution or chemicals in direct contact with the lining of our airway triggering an asthma attack. Ingested substances are less likely to cause an asthma attack, and food rarely is the culprit as there is no direct contact with the airways. Although food rarely causes an asthma attack, food additives like preservatives and medications like beta blockers, aspirin, and ibuprofen are known triggers. Physical factors like changes in weather or exercise can trigger an asthma attack. Sudden changes in the temperature or the water content of the air can trigger asthma symptoms. Cold air, extreme temperatures, weather changes, thunderstorms, and high humidity are the potential triggers. Exercise may cause a sudden change in the volume of air, triggering an attack. Stress and emotion can cause an attack. With children, this can also be when their parents are under stress. The child can sense the environment and is more susceptible to an asthma attack. How is a child diagnosed with asthma? Although signs and symptoms like wheezing, coughing, and difficulty breathing are highly indicative of asthma, these symptoms may also be caused by other lung issues, cardiac issues, or something else. Therefore, it is necessary to do a comprehensive assessment by the appropriate medical provider to include a detailed history, a physical examination, and lung functioning tests. A little more on the diagnostic testing. Physical exam and social history. It is important to review symptoms, typical patterns of occurrence of symptoms, triggers and aggravating factors, chronological history or timeline of the patient's asthma, family history of related medical problems, patient's social history, current living environments, current lifestyle and habits, impact of asthma on patient and family, perception of the disease by patient and family. Spirometry testing. Spirometry is a test used to diagnose asthma. A spirometry test measures how fast and how much air can move in and out of the lungs. This test uses special equipment in your doctor's office or hospital clinic, a mouthpiece that is attached to a recording device. Then we breathe in and inhale as deeply as possible, and after we blow out and exhale as hard as and as fast as we can. The spirometer will measure how much and how fast air was exhaled. This test is used for children ages 5 and above. Peak expiratory flow, or also known as PEF. This is also measuring how much and how fast air was exhaled, but is a home test. To monitor at home, peak expiratory flow, or PEF meters, are recommended. A chest x-ray can rule out another pathology that may be causing the asthma-like symptoms and should be included in an initial assessment. Allergy testing may be included if your doctor feels the symptoms may indicate allergies. There are different skin and blood tests to see the response to different suspected triggers. How is pediatric asthma treated? Treatment is directed at carefully managing and monitoring symptoms. Optimizing and controlling symptoms will reduce asthma attacks and prevent scarring and further decline in lung function. Management is thought of in two parts: daily long-term control and treating asthma attacks. To control asthma over the long term, a child may need daily medication. Many children take medication daily, usually an inhaler with corticosteroid. Because it may be difficult for a child to use an inhaler, there is a device called a spacer that can attach to an inhaler and looks like an extension of the inhaler, making it safer and more effective to use. Taking controller medication daily helps reduce the swelling of the airways and helps prevent attacks. Lung functioning can be monitored at home with something called a peak flow meter. Peak flow meters are inexpensive handheld tubular devices that record the maximum flow of air while a patient is forcefully emptying their lungs. This measurement is called peak expiratory flow, often referred to as PEF. This measurement is similar to the spirometry testing but is done at home. Daily monitoring with a peak flow meter will establish a baseline PEF. If the PEF declines, it may indicate infection or higher risk for asthma attack before the attack happens. Monitoring daily PEF also gauges the effectiveness of medication and other treatments. When an asthma attack occurs, a quick relief medication may be needed. Your child will use quick relief medicines such as albuterol during an attack. A nebulizer or breathing machine is another way to take inhaled medicines. A nebulizer treatment is given with an air compressor machine. Pressurized room air is used to create a mist of the medicine solution, which is inhaled for approximately 5 to 10 minutes. A face mask is available to use with a nebulizer for very young children. Developing a detailed and easy-to-use written asthma action plan is key to managing the condition. A written asthma action plan will include daily medication, PEF baseline, tracking of symptoms and efficacy of medicines, triggers, quick relief medications, and when to use them. It is important to have a separate written asthma action plan for school or daycare. This should be simply written and easy to interpret and may include a short explanation of your child's history of asthma, what symptoms to watch for, contact information for doctors, nurses, parents, and or guardians, a list of the child's asthma triggers, the child's best peak flow reading, a list of medications and how or when they are taken, health insurance carrier, suggestions on how the child can be physically active during gym and recess. Managing the condition of asthma is about optimal control with daily medications and managing our environment to avoid triggers. Learning how this disease presents in children, taking long-term control medication as well as quick relief medications as needed. Monitoring the lung function with daily peak flow meter reading as well as having a written asthma action plan developed with the doctor can lead to effective management and avoid further progression of the disease. Living with asthma. As a child gets older, they are able to take on more responsibility for asthma. Every child should have an asthma action plan for home and school. Children will need to be monitored and followed by their physician ongoing. A specialist like a pediatric allergist or pulmonologist may be necessary if symptoms are not well controlled or the condition is getting worse.